Hello, dear colleagues. I'm presenting study findings on health-related burden of EU candidate countries based on public health indicators analysis. Various studies have shown the ebb of the political spectrum when determining entry into the European Union. The objective of this study was to identify the key differences between European Union and the current EU candidate countries through the lens of the financial burden of the public healthcare system. The most complete and available Eurostat data describing recent health-related burden with 13 indicators for current EU candidate countries were evaluated and compared with EU average. Current EU candidate countries are Serbia, Turkey, the Republic of North Macedonia, and Montenegro. Total health expenditures expressed as purchasing parity power per capita in EU candidate countries is almost one-third of that in the EU. General government health expenditures for all four countries was below the EU average, with Montenegro spending the highest and North Macedonia spending the least. Turkey, with a significantly higher gross domestic product, allocated the smallest percentage of its GDP on health, just 4.3%, while Serbia allocated the highest percentage of its GDP on health, 8.6%, but both being below the EU average of 10% of the GDP. The private health expenditures for all of the countries was higher than the EU average, with Serbia's proportion being double that of the EU average. Assessment of the burden of disease for these countries has shown that Serbia has the highest disability-adjusted life years rate per 100,000 population, while the average daily rate of the other three countries was a bit smaller, and the EU average daily rate was significantly smaller than the daily rate in Serbia. Turkey and North Macedonia tying for the highest infant mortality rate, 3 times of the EU average. Of the candidate countries, Serbia contains the highest density of physicians and nurses, and Turkey the lowest. Study key messages and conclusions are the following. The process of entry to the EU is a varied experience for each country, since attaining benchmark standards in healthcare affects the time and resources needed to achieve them. This study on a selected number of public health indicators contributes to the evidence on the current health-related burden of EU candidate countries. All EU candidate countries have a much higher burden of disease and a much lower health workforce and health expenditure than the EU average. The challenge for countries in the accession process is to reach a level of quality and achievement in the health care in the EU. Thank you.